Welcome to the Research Center on Aging.
The Research Center was created 20 years ago to complete the good healthcare and services provided at the Institute of Geriatrics, and also the training of health professionals that was developed at the Institute by research that generate new knowledge, and then the knowledge could be translated to the healthcare professional and also to better healthcare and services for older people.
It was actually a success since only 20 years later, we have now very strong and renowned research teams working in improving clinical care for the elderly persons, such as telereadaptation or organization and management of healthcare services. And we also train more than 100 students within our research center in very various and diversified programs.
And what I want is to improve quality of life and well-being of elderly, and moreover I love physical activity, and I like the idea that I can improve health of older adults and decrease the risk of chronic disease, and I think that I can do this at the Research Center on Aging. As a postdoctoral fellow, it's very important to have an access of a lot of services such as statistician, information, that we can help us to do a good job, to do a good research. And at the Research Center we have this, and moreover we have a library, and we can order an article and you can receive it on your desk. It's amazing.
One interesting aspect here at the Research Center on Aging is the interdisciplinarity of the research we can conduct, mainly because we're professors from different faculty of the University of Sherbrooke. Our graduate students have their workplace here at the Research Center on Aging, and that allows them to interact with investigators and professors from all faculties that are affiliated here at the Research Center on Aging.
I chose the Research Center on Aging to do my research program and to be a researcher because it's a highly stimulating milieu, and because there is many services and many opportunity for me to do research and to apply it in clinical setting. At the Research Center on Aging, I have help from statistician, informatic help, and also secretary, that helped me, and administrative help to help me to apply to do my research project, and to also to disseminate the research result. The Vitae Foundation helped us to do clinical research based on clinician interest in research. So it's a funding opportunity to do research that will help the clinician to do their work.
Well, Sherbrooke has established a research center on aging that is one of the best in the country and competes with the best in the world as well. One aspect that we're very interested in is how the brain ages, and for that we need tools that allow us to look inside the brain. And that involves, in our case, imagery. Imaging methods like PET scans and MRIs. And these methods are so well developed in Sherbrooke, it's one of the best centers by far in the country. So we were able to really focus on the types of questions around how the brain is fueled in this environment here, which we would have had difficulty doing anywhere else. Aging is part of a dynamic in the population now that brings a lot of disease and costs for the healthcare system. So it's important to understand how to age better and to optimize the quality of our aging.
Je suis responsable du programme de maîtrise en gérontologie, et le programme de maîtrise en gérontologie, que ce soit la maîtrise de doctorat, c'est un des seuls programmes francophones en Amérique du Nord, donc qui est spécialisé au niveau de la gérontologie et qui est riche par sa multidisciplinarité puisqu'il regroupe des étudiants qui viennent de différents domaines et différentes formations. En fait, on est une équipe de 6 chercheurs dans le domaine fondamental du vieillissement et 6 chercheurs qui sont tous reliés au niveau des pathologies liées au vieillissement, notamment les maladies cardiovasculaires, le déclin cognitif, la maladie d'Alzheimer et le cancer et la sarcopénie. La recherche fondamentale dans le domaine du vieillissement est un domaine qui est appliqué justement dans la vie quotidienne. Et on a un exemple de projet en cours, l'IPAGE, qui regroupe 240 sujets au niveau desquels on essaie de voir l'effet de la consommation d'huile d'olive sur certains marqueurs de la santé, notamment en lien avec les maladies cardiovasculaires.
One of the big strengths of this research center is the transfer of knowledge into not only new products, but also new services, new program, and new policy. We developed here assessment instrument to evaluate the needs of people that are actually implemented in Quebec and also in other countries. The same is true for some service organization system that are actually in implementation in Quebec and in other countries in the world.